Dr. Goetzel is responsible for leading innovative projects for healthcare purchaser, managed care, government, and pharmaceutical clients. Interested in conducting cutting-edge research focused on the relationship between health and well-being, medical cost, and work-related productivity. He's internationally recognized and widely published and expert in health and productivity management, return on investment, program evaluation, and outcomes research. He has published well over 200 peer-reviewed articles and book chapters and frequently presents at international business and scientific forums. And now he is serving on our Gold Standard Council, which is a board advisory committee to the CEO Roundtable on Cancer. So welcome, Ron.
Well, thank you, Andy, for inviting me. It is an honor and a pleasure to be here with you this afternoon, if only virtually. Yes. So thank you.
So to start today's meeting, I have just a few slides to kind of ground us on what we're talking about well-being, and then we'll quickly get into Ron's presentation. So the next slide, please. When we talk about well-being, how it's really the definition we like to use is how people think, feel, and function at a personal and social level, and how they evaluate life. It's not very medicalized, but when we look at well-being, it shouldn't be medicalized at all. The next slide. As we look at the well-being pillar, it's a new pillar that's involved in the gold standard, and it's really focusing on the determinants of health from a context of cancer prevention, treatment, and survivorship. It's really focused on creating a work environment and a healthy community. And we're offering, and it's going to be focused on mental and emotional health, financial health, social, spiritual, purpose-driven, and environmental health too. So it's an all-encompassing pillar on its own, but it's embedded in each one of the pillars, the other four pillars within the gold standard. And the last slide is some work that I did as I co-chaired the Health Leadership Council with the Conference Board. This is where we looked at the work environment, and believe it or not, the work environment's changing. It may not be physical environment. It will likely be more virtual, but it's still a work environment. And where a person comes to work with their own well-being, positive or negative, but the work environment can make a positive or negative impact on that individual. And we've had, when in my prior role, we had a number of employees who really thrived at work and then changed into a different work environment and actually deteriorated too. So this kind of gives you an idea of where we see the work environment impacting someone's well-being, and as employers are trying to measure this too, some metrics that may help them along. So that kind of grounds us on what we're talking about well-being. Now I want to shift it over to Ron to get into a lot more detail in the research there and what his line of thinking.
All right. Well, thank you very much again, Andy, for introducing me and giving me this opportunity. And let me see, I've got this little app here that's supposed to work. Okay. I only see half the slides, but I'll try to see what I can go through. So we are looking to change the game in cancer by bringing in well-being into the equation. We know that health is much more than your physical health. It has many, many different components attached to it. So I'm going to, basically talk about why these things all matter. And indeed, right now, we can look at our history as life before and life after COVID-19. We're right now in the life after period, and so many things have changed. So we are struggling. There are these overlapping crises that are going on simultaneously. Certainly the pandemic. We also have social unrest in the street. And then we have the economy that's in many ways deteriorating, collapsing around us with unemployment and GDP downturn and so forth. So there are all these tensions and stresses that employers and employees have to deal with. And you can think about it as different curves. Actually, if we can go back one slide. So there's the first curve, which we're right in the middle of, which is infectious disease, but right behind it is the mental health curve, depression, anxiety, isolation, opiate addiction, those kinds of things. Social equity is unemployment, health disparity, social determinants of health, which are much further upstream, and then chronic diseases, including cancer, which we have to deal with. And these are things that are going to go through various curves, and we're going to have to deal with them along the way. So before all of that, what the question I always like to ask my audience is, why do you want to be healthy? Because it's really hard to lead a healthy lifestyle. You got to eat the right things. You've got to exercise, not smoke. You've got to get enough sleep. You got to be socially interactive. You got to manage your weight, blood pressure, cholesterol, all those things in order to be healthy. Now, the next question, though, is why does your boss want you to be healthy? So oftentimes when you ask the C-suite, CEO, CFO, well, they'll tell you, well, our medical claims should go down, should have less absenteeism, fewer safety incidents, more engaged and productive workforce. And of course, we want a positive return on investment, a positive ROI. And the question then becomes, what's in it for me? I'm the employee. What do I get out of it? Where's my ROI in all of this? And the way to also think about it is that a happy employee is a productive employee. Actually, there's a lot of really excellent research coming out now showing that there's a direct cause and effect relationship between happiness on the job and one's productivity. But how do you get happy? Is there a link between happiness and worker health and well-being? And what this shows is that, yes, they're all interconnected. There's physical health, there's emotional health, mental health, social, spiritual health. Spiritual health being, sense of purpose in life and a mission in life, and that also translates to your work life. So these things are all interconnected in very important ways. So stepping back from all of this, we're all in the healthcare business, whether you're manufacturing cars or pharmaceuticals or widgets, whatever it is, everybody is in the healthcare business. And right now in this country, our latest statistics, this is even before the pandemic, back in 2019, we were spending $3.6 trillion a year on healthcare. And that translates to over $11,000 for every man, woman, and child. That's roughly 18% of gross domestic product and is going to go way up unless we get our arms around treatment and prevention. So what can we do about this? All right. So obvious things are adopt healthy habits. Things like don't smoke. Let me just go to my slide so I can see these better. All right, don't smoke, eat healthy, get regular physical activity, avoid drinking too much alcohol, get screened, get enough sleep, know your family history. But then bolded down below is make healthy choices in school, at work, and in the community. It turns out that about 90% of this $3.6 trillion that we're spending every year on healthcare is spent on people with chronic physical and mental health conditions. And why are we thinking about work? Well, it turns out that we're spending more time at work than we are sleeping. And we're spending more time at work than leisure, sports activities, eating, drinking, taking care of other people. We spend a lot of time at work, and it's an opportune setting and a space for us to actually get healthy, both physically and mentally. And the way you do that is by creating a healthy company culture. This is a term coined by the Robert Wood Johnson Foundation. Building healthy company culture. So culture of health is one in which good health and well-being flourish. Everyone has the opportunity to make choices that lead to healthy lifestyles. And this has become much more true and more relevant in the last year or so. If you may recall, back in August of 2019, the Business Roundtable, which is a conglomeration of 180 plus companies, Fortune 500 companies, got together and said, you know, we as businesses, as corporations, have a responsibility not just to our shareholders, but we also have a responsibility to other stakeholders out there. And those stakeholders include our customers, our employees, our suppliers, and the community. Next slide. So what are some of the examples of best practices in terms of developing a culture of health? We've done a lot of research out there over time. This is research done with support from the Robert Wood Johnson Foundation, where we went out and visited companies that did an excellent job of having a good culture of health. Many of these companies have won the C. Everett Koop Award. Andy Crichton is a board member of the Health Project, which each year hands out the Koop Awards. And what do we learn? Next slide. Well, the secret sauce, number one on the list, is developing a culture of health. Next slide. Down at the bottom, of course, is measurement and evaluation, which means that not only do you have to have all these good things in place, you need to also document, measure them, have listening posts to make sure that these things actually work. Next slide. And well-being is integrated and incorporated into all of these principles related to culture of health. So when you think about it, and this is work that is being done by by NIOSH, National Institute of Occupational Safety and Health, as part of their total worker health initiative. Worker well-being, very simply stated, is an integrative concept that characterizes the quality of life that enables workers to thrive and achieve at their full potential, and has many different components attached to them. And why is this relevant? Next slide. Well, next slide, we've done some research out there that is trying to get the attention of people who are beyond the chief medical officers and the people who actually run programs, benefit managers and so forth. We're trying to get the attention of the CEO. So we've done a series of studies that have looked at companies with outstanding health and well-being programs and looked at their stock price over time. So this is an example of a study where we tracked back to 2001 and looked at companies that have won the C. Everett Koop Award back to 2001, and then followed them over time in terms of their stock price and compared that to the S&P 500. Next slide. And lo and behold, if you looked at these companies, actually it's a pretty small portfolio, about 26 companies, they increased in value by 325% versus the S&P 500, which only doubled in value. Their value increased by about 105%. So essentially you're getting a 3-to-1 return on investment if you had invested in these companies that are focused on the health and well-being of their population. Next slide. More evidence, there's some more recent research that we've done. This is again with the Robert Wood Johnson Foundation, a shorter time horizon, looking at companies that have performed well in terms of their culture of health over a shorter time horizon. And once again, these companies outperform the S&P 500. Next slide. So bottom line, there is good evidence out there that these programs that incorporate physical, mental, social, intellectual, financial, spiritual health into their core agenda, into their mission, their vision, what it is that they do, but they also have best practices that accomplish these things, that if you create a culture of health inside your organization, incorporating worker well-being, that they actually have significant positive outcomes. There are good financial outcomes. We've done a series of studies looking at the return on investment from these companies, measured in terms of medical cost savings, lower absenteeism, short-term disability, fewer safety incidents, workers' comp claims. But again, that has to be linked to health outcomes and population health. Adherence to evidence-based medicine, behavioral change, risk reduction, health improvement of the population. And then this third category, which we're now calling value on investment, improvement of the quality of life of your workers, which in turn enhances their productivity and happiness, improve functioning, attraction and retention of your valued employees, top talent, employee engagement in their work, demonstrating corporate social responsibility, enhancing your reputation, and then, yes, even demonstrating a higher stock price for those companies that have adopted these best practices. And with that, Andy, I'll turn it back over to you, and then we can open it up for questions.
All right. Thanks, Ron. So I want to remind everyone, if you want to ask a question, at the bottom there is a link to send a question in to us, and we will ask it. And if we run out of time, we'll make sure we get back to you with an answer. So thank you, Ron. I think it's a simple concept, but a very complicated way to deliver and, like you said, get attention. So one of the things I want to ask you is, in this new work environment, working from home, how can companies support an employee's holistic view of health? And are there any good examples you could share?
Yeah, I think it is much more difficult as we're all sitting at home. We're not interacting with people. We're not having conversations at the water cooler. We're staring at screens all day, which is crazy. It is very hard, and people get Zoom fatigue. They get tired of constantly being in meetings and having their face on screen and noticing that their collars are awry and things like that. So it is very hard, but some companies have done a pretty good job of creating these virtual environments, whether it's yoga, physical activity, meditation, just teaching people, how to eat healthy. If they want to engage in other health improvement activities, they can do so. And essentially, it's kind of like a university that's now brought online, that you can begin to learn things and also engage with your fellow workers, perhaps in ways that you didn't do it before. But there's no question about it. It is, for many people, very socially isolating. Of course, for people who were teleworking even before this, they were feeling that. They felt like they were off on their own island and they were not connecting and communicating with people socially or otherwise. I think it's going to take a while for us to get used to this, and I'm not even sure we will ever get used to it because we are social animals. We want to interact. I enjoy sitting and having dinner with you, Andy. I enjoy meeting other people, telling jokes, schmoozing, doing those kinds of things which are much, much, much harder to do right now. So I think we have a real challenge to do that. Now, having said that, I think there are still things that can be done, and there are systems that can be put into place, better EAP systems, training managers on how to demonstrate that they care about your health and well-being. I know when I have meetings with my staff, which I've always had virtually, the first few minutes are, how are you doing? How are the kids? What's going on? Is everybody healthy? Are you getting out? What's your plan? So to engage people, but yeah, it is feeling a bit artificial. I think it's going to be very hard.
Yeah, I know that I've had conversations with the organization, and the one thing that they want to focus on is empathy, because it's very hard, even in a two-dimensional world, to do that. It's better than on the phone, but we are social animals, and that three-dimensional interaction has a lot of good feedback on understanding maybe if someone's having an issue too. So I don't know if we'll ever get there, but it's something I think that companies need to train for and train their managers in how to be better virtual managers too. So.
And one other thing that comes to mind, Andy, and I know you did this at Prudential, is having a very robust volunteerism program and community service program. And by the way, there's technology out there that can connect you with what you want to do in the community. So if you want to hand out food, here's a place you can do it. If you want to go to homeless shelters, here's a place you can do it. If you want to support people in other ways, provide tutoring or whatever, here's a way to do it. When people go outside of themselves and give to others, they really do feel better about themselves. And it's also a way of socially interacting with other people. I know my wife gives out free food in the community on a regular basis and loves doing it. She interacts with other people. Everybody's wearing masks, everybody's socially distancing and so forth. But, you're out there, you're actually engaging with people and you're feeling that your work is worthwhile.
Yeah. Yeah, you have to have a sense of purpose. I know IBM classifies it purpose. At Prudential, we did spiritual health too, but you have to feel like you're part of something bigger than yourself. So well-being feels a little bit softer, broader area of interest. How would one go about measuring this, and how do you evaluate where your employees are in that well-being space?
Yeah, it is a broad concept, absolutely. It has component parts to it, so the obvious category is depression, and there are, well-validated scales out there, anywhere from the PHQ-2 to PHQ-9 that can measure depression in people. There are anxiety scales out there. There are social isolation scales out there. So there are a number of different scales, but even asking people outright, how would you rate your well-being, your mental health? People are actually quite direct and honest in telling you when they're feeling miserable, and so you can track those things. Now, of course, it has spillover effects into physical health. So if you're not feeling well and cared for and having a sense of social support, you're going to start getting a lot of physical ailments, and your immune system is going to be stressed by that. So basically, it opens you up, makes you more vulnerable for other diseases that may be out there, including, obviously, COVID-19.
Yes. Yeah, and I think we've seen an increase in depression, anxiety with COVID-19. I think a lot of it is that isolation. A lot of it's even the unknown. When are we going back into the office? And so during this time period, the focus on well-being seems like it should be even more heightened for these companies than just in our normal work environment.
Mm-hmm. Absolutely.
So that wasn't a question, that was a comment. Sorry. So in your presentation, you used the word flourish. I really like the word flourish. It was after a meeting with a group of companies from France, because they used it all the time in how to engage their employees. How do you think that resonates with the U.S., the American workforce, that word flourish, and how do we make it more acceptable?
Yeah, actually, if you go back to Maslow's hierarchy of needs, way back yonder in Psychology 101, and his triangle was basically basic human needs like air, water, food, shelter, things like that, and then you go beyond that. But at the top of it is a sense of self-actualization, and the other scale out there is Cantrell's ladder, which actually does range from struggling all the way to thriving and flourishing at the other end. And it's a step beyond you being self-actualized, I think, I think a sense of helping others actualize. So kind of taking the focus beyond yourself and, doing all the things that you can do to become a good person, but then helping other people become good people. And when we do that, I think we do flourish. So whether it's even, in your family, in your neighborhood and community, and at work, if you can help others, get a sense of self and worth and mission and common goals and a sense we're actually accomplishing something together, that's when not only you flourish, but also your community flourishes.
So talking about community flourishing and again, public health being with the Bloomberg School of Public Health, what examples of companies do you have that are very focused on this more holistic view of health and how they're even influencing the community in which they live and work?
Certainly you can look at winners of the Coop Award for the last 25 years or so, and you can go to our website, thehealthproject.com, and again, Andy is a board member of the Health Project. And you can look at what they've done over the years. Now, the interesting thing about the Coop Award is it's not just we're doing these things, but we actually have data and documentation that we've improved health and had a business impact. So you've got to have both sets of criteria in order to win the Coop Award. But there are lots of examples out there. One that I just recently became familiar with is BSR, which is Business Social Responsibility. They also have a website. It's an international group, but they also have case studies and examples of companies that have done an outstanding job in giving back to their communities and being socially responsible. So I think there are actually now a growing number of organizations, B companies, B corporations, I think they're called, those that are focused on corporate social responsibility. There are different tracks, but they're all trying to do the same thing. And I think you can find some excellent examples. Prudential, certainly, where you were the chief medical officer, Andy, was an outstanding example of a company that does it right. Johnson & Johnson is on the list. Ericsson is on the list. Dell Computers, USAA. I think one of the defining elements of these companies is they have a very inspirational and chief medical officer, chief health officer that sees beyond the horizon, sees long term, and is it in this space for the long term, and wants to take the rest of the company with him. I think that's a very important factor, having a chief medical officer that is focused on the bigger issues and in some cases even leaving a legacy behind.
Yeah, and I think that's interesting in that there was a Forbes article recently that talked about having a C-suite level chief well-being officer to really focus and to bridge not only on the employees, but how it could impact their product, their customers, the environment, so that sustainability. So, that I think that does make sense. It's just trying to get the attention of the C-suite to understand what it is and how it can really contribute to the bottom line of the company.
Yeah, I think there's actually a lot of data, a lot of evidence. Our challenge is to communicate it to the C-suite. They have 5 minutes with you, let's say. And so you've got to have an elevator speech prepared that is very compelling and very convincing. And you've got the backup, of course. But, I think a chief medical officer, chief health officer, chief public health officer, chief health and well-being officer, whatever you want to call the person, that person can be the bridge between the C-suite and what the company needs in terms of health and well-being.
Yeah. Probably one more question here. So what do you see the role of the CEO Roundtable on Cancer and our gold standard moving forward? Because again, as members, we've got the C-suite as our members and our board members too. So.
Well, I mean, that's the person or people you want to influence the most. They actually set the direction for the company. So, and as some of the classic companies that introduced health promotion, wellness programs back in the 1970s and 80s, those were driven by the CEOs of the company. And they believed it personally. This is important to them. And they said, all right, this is what I want you to do. Go out, figure out how to do it. But you've got my backing, you've got my support, my resources, my commitment to make sure this happens. So they're the ones who can make things happen. And that's why CEOs, the C-suite, are so important in advancing some of these ideas.
So in this last minute, what is a call to action that you want us to do? And again, those dialing in to really move this forward.
I think going to someone knowledgeable like a chief medical officer or people on the cancer CEO roundtable, and basically saying, what can we do? Now, there are lots of scorecards, there are a lot of guides out there, there are a lot of things that we can place in front of companies. They can't do them all, but start small, start checking off the things that you can do in terms of programs, policies, environmental supports in all of these various areas. And you'll gradually get there into a state of nirvana and thriving.
Well, thank you, Ron, for taking the time to enlighten us on well-being, and thank you for your contribution to the Gold Standard Council because we definitely need it going forward. For those of you attending, I want to thank you for taking the time to attend. There will be an evaluation being sent to you to give us feedback. Please let us know. This is our first virtual event, and let us know what we can do to make it better. As I said at the beginning of the session, the general session, this is just the beginning. So we will have upcoming series in fourth quarter and first quarter of 2021 on HBCU initiative and its launch, the gold standard implementation, accelerating clinical trial participation and access, and again, creating a well-being environment. So there is more to come. We'll do deeper dives in this, but thank you for your attention and your participation today. Have a good day.